Yes. We move to the next chapter, that is gulma chikitsa. So gulma, if you want to understand gulma, you have to read Charaka Nidanasthana, third chapter, Gulma Nidanam. So where Acharya has given a in detail explanation of how gulma develops. In a simple words, we can understand the gulma in terms of any physiological changes to anatomical changes in GIT tract, any physiological changes or anatomical changes in the GIT tract, which may lead to pain in the abdomen, pain, and it can be palpable, palpable swelling, like it can attain a shape of palpable swelling. So any of these pathologies which is painful, which is palpable, which is moving or changes its shape backed by physiological changes or anatomical changes in the GIT tract, can be grouped under the disease called as gulma. So gulma may be a simple acid peptic disease. Gulma may be a simple spasm of pyloric sphincters, spasm of esophageal sphincters, spasm of pancreatic ducts or bile ducts, common bile ducts, hepatic ducts, or it may present as expansion like congenital megacolon. It may be interception, a part of the intestine enter into the next distal part, that is telescoping of intestine, interception, or maybe because of any infection leading to inflammation in the GIT tract, like viral infection, typhoid infection leading to inflammation of GIT, or perforations, ulcers, tumors, benign tumors, malignant tumors, all these can be included under gulma pathology. So gulma is a vast spectrum of diseases in the GIT. So first level of gulma, or how gulma develops. Imagine there is a GIT tract, for example, stomach or intestine. You can see there is a mucous membrane is there, submucous membrane is there, muscular layer is there, serosa layer is there. Any changes in these layers, any of these four layers, or excessive dehydration, or uh, if the secretions become very less in the present GIT, usually GIT will be filled with secretions, fluid, etc. But if the secretion becomes less, what happens? The GIT or the intestine will become ruksha, will become dry. So that is the first step of gulma pathology. So you imagine a GIT tract which is becoming a dry, which is becoming a hard, which is becoming a inflamed, which is becoming a breaking, like ulcers, going into deep ulcers and then perforations, it becoming a hypertrophy or hyperplasia, finally leading to benign or malignant tumors. So all these will be included under gulma. So in Nidanasthana third chapter, Acharya explains that when Vata Prakopa occurs in Mahakosta, Mahasrotas or Mahakosta, Vata Prakopa occurring in the GIT tract. So that is the first level of pathology of gulma. So we'll start with the shloka number 4, 5. So this is the causative factors for gulma. Which shleshma pitta ati parisravadva. So if there is excessive evacuation of wit, shleshma, pitta, ati parisravadva. So imagine there is a GIT tract, there is a ample lubrication, ample mucus secretion, ample fluid secretion, etc. If this fluid is evacuated excessively, excessive diarrhea, excessive vomiting, or because of some GIT infections, GIT irritations, if there is a excessive evacuation, so the amount of sneha dravya in the GIT becomes less. That means vata is increasing, rukshata in the GIT is increasing. Teraiva vruddhehi paripidanadva. If there is any compressions, paripidanadva, compressions or pressure symptoms. After intake of food, the person is going for jumping, jogging, cycling, or any travel, etc. So this all will give compression, congestion over the GIT tract. So that is paripidanatva. Veger udiraner hater adova. So if the Vegas are um, suppressed or Vegas are initiated, so that will cause disturbance in the GIT tract. Bahya abhigatair atipidanirva. So external injuries, external pressures over the GIT tract, etc. Ruksha annapana. Ruksha annapana means divide of snehamsha. If the ahara is excessively ruksha, divide of snehamsha, so that will also cause less secretions in the GIT tract. Shokena. If there is any psychological dysfunction, shokena, there will be disturbance in the GIT tract. Mithya pratikarmana. If there is a abnormal samsarjana krama, abnormal panchakarmas, that also will cause abnormality in the GIT tract. Vicheshtiterva, abnormal actions. Vishama atimatraihi. So excessive or excessive evacuation or excessive panchakarmas. So all this will cause kosta prakopam samupaiti vayu. So vayu becomes prakopa in the kosta. What is kosta? GIT tract. So imagine there is a mucous membrane, there is a mucous secretion, intestinal secretion, etc. If these secretions becomes completely less, or if these secretions are evacuated more, dehydrated more, the GIT tract first it becomes dryness. You can see a dryness or hardness, etc. So that is nothing but we tell that word vata prakopa or vayu prakopa. So this vayu, what it will does, because of the excessive dryness, all those things, it may cause stimulation of mucus secretions, it may cause stimulations of other intestinal secretions, GIT secretions. So kafam cha pittam cha, again enzyme secretion or HCl secretion, vasoactive intestinal peptide secretion, intestinal fluid secretion. So the combination of kapham and pittam, so there is maybe excessive secretion, or the secretion may be hampered, or the secretions are not in a right consistency or contents, or the quality quantity may be missed because of the vata prakopa, disturbance in the GIT tract. Dushta vayu ruddhuya margan vinibadya tabhyam. So these may cause spasm, these may cause um, heavy expansion, or this may cause abnormal peristaltic movements. So anything can happen. So margan vinibadya, so there may be obstruction in the marga. Margan vinibadya, obstruction in the margas. What are all the margas? GIT tracts, their associated branches, their associated blood vessels, all these may be obstructed, or there may be spasm, there may be irritation, there may be inflammation, there may be ulcer formation, there may be perforation, there may be tumor formation. So anything can happen because of all these things. So because of all these things, if there is any pain, shulam in hrudaya, nabi, parshva, udara, basti, shulam. So hrudaya means we should take it as a epigastric region, nabi, umbilical region, parshva, hypochondric region, lumbar region, iliac region, udara, basti. Basti means hypogastric region. So in all the nine quadrants of abdomen, there may be shulam. Shulam karotyatu. Why I'm stressing on these pathology means we can just move on to this chapter, but gulma is not an imaginary disease. Gulma, avarana, these type of diseases, it is difficulty to understand, but they are not imaginary disease or outdated or extinct disease. They are the more practical disease available right now. Um, Now we have got many instrumentations like endoscopies, colonoscopies, etc. We have MRI, we have a CT scan, we have ultrasound. So based on this, we can identify these conditions. So imagine the intelligence of our acharyas, their deep thinking, deep understanding of these type of diseases without any sophisticated instrumentation. Could have identified the pathology. They might have named in a different way, but the pathologies are evident. The pathologies are more practical. Pathologies are available in many conditions. So those are all the important conditions related to gulma, especially related to GAT tract. So pakwashe, pitta, kafashe. Pakwashe means intestine, large intestine, small intestine. Pitta, kafashe, GAT tract, duodenum, stomach, kafashe, esophagus and stomach. So in all these areas, sthitaha, swatantraha, parasamshrayo va, Sparshopalabhya. So it is palpable swelling, Sparshopalabhya. It may transform into congestion, it may transform into expansion, it may transform into spasm, it may transform into benign hard tumor, or it may be a abnormal peristaltic movements, palpable, visible peristaltic movements. So all these come under paripindita sparshopalabhya gulma Yadoshamupaiti Nama. So the gulma is any painful colicky pain presenting with colicky pain, palpable sparshopalabhya, paripinditatva, palpable spherical or irregular swelling, palpable irregular swelling presenting with pain in the abdomen, we can call it as a gulma. So wide range of presentations we can notice in the terms of gulma. So these are all the main sthanas of gulma. That is basto. Basto means we should take it as a hypogastric region. Nabhyam means umbilical region. Hrudi means we can take it as a epigastric region where esophagus, lower upper part of the stomach and heart, mediastinum, esophagus, bronchus. So all these are involved. So that is the Hrudi stage. Parshvayor. Parshva means we can take a hypochondrium, lumbar and iliac region of abdomen quadrants. So these are all the five sthanas of Gulma. So Basti, Nabi, Hrudaya, Parshva. So these are all the five sthanas of Gulma. So five types of Gulma can develop in these areas. So first one is Vataja Gulma. Vataja Gulma main causative factor is Roksharnapanam, Vishamatimatram, Vicheshtitam, Vega Vinigraha. So already I have mentioned. So how to understand the pathology of the Vataja Gulma. Once you understand the pathology of the Gulma, rest of the conditions becomes easier. So Vataja Gulma may be anything which is characterized by spasm, anything which is characterized by expansion, anything which is characterized by excessive peristaltic movement, anything which is characterized by hardening of the GIT tract, sclerosis of the GIT tract, muscular dystrophy of the GIT tract, or excessive dehydration of the mucous submucous membranes. So all these come under Vataja Gulma. So Vataja Gulma spasms, expansions, volvulus, interceptions, uh, polyposis, abnormal familial polyposis. So all these can be included under Vataja Gulma. So what is the presentation? Shishira Jwaram, there may be fever with chills. Hrut Kukshi Parshva Amsa Shiro Rujam. So there may be referred pain, there may be pain in the abdomen. Hrut Kuksha epigastric region, Kukshi abdomen, Parshva, all the flank region, hypochondriac region, lumbar iliac region. AMSA, you underline this word AMSA. It may be a referred pain. For example, you might have seen in cholecystitis or cholangitis. Cholecystitis, if there is a inflammation, infection in the gallbladder, there is a referred pain towards the scapular region, shoulder region, scapular region. This is a referred pain. So actually, I have noticed this referred pain also. So AMSA shirorujam. So headache will be there in most of these abdominal conditions. So Hrud Kukshi Parshva AMSA shirorujam is the main presentation. Shava Arunatvam, the person may turn into slightly grayish color or orange color. Shava Arunatvam. Vidvata Sangam, there may be a constipation, abstipation, Gala Vaktra Shosham, dehydration type of features. Jirne Abhyadikam, at the end of digestion, the pain increases, whereas the pain reduces after right after intake of any ahara. Mrudutvam Bhukte. So these are all the things seen in Vataja Gulma. Whereas in Pittaja Gulma, one more point we need to understand in Gulma pathology is Vataja Gulma is the basic pathology. Vataja Gulma is the basic pathology. What I have told, spasm, all those things, that is the basic pathology. With that basic pathology, if a person involves in Pitta Prakopa Ahara Viharas like Katu, Amla, Tikshna, Ushna, Vidahi, Ruksha, Krodha, Ati Madhya, Arka, because of intake of Pitta Prakopa Ahara Vihara, already the condition is spasm is there. If there is Pitta Prakopa, then there will be inflammation. Already there is a hardening is there in the GIT tract. If the person undergoes into Pitta Prakopa, it will turn into inflammatory reaction. Already there is a swelling is there. If the person go into Pitta Prakopa, then the swelling may burst, like it may cause ulcers, perforations, etc. So Pittaja Gulma is nothing but any inflammatory condition of the GIT tract, like gastritis, esophagitis, duodenitis, cholecystitis, hepatitis, etc. Meckel's diverticulitis, appendicitis. So all will come under Pittaja Gulma. Any inflammatory conditions related to Pittaja conditions, you can notice the Pittaja Gulma. So Vataja Gulma basic pathology is hardening, spasm, contusions, contractions, excessive peristaltic movements, etc. If the same conditions are hyperimposed with inflammatory conditions like appendicitis, colitis, ulcerative colitis, perforation, gastritis, duodenitis, cholecystitis, all itis, all inflammatory conditions, so that will turn up into Pitta Jagulma. So Vata Jagulma turning into Pitta Jagulma because of intake of Pitta Prakopaka Ahara Viharas. So it is characterized by Jwara, Pipasa, Vadana, Anga, Raga, Shulam, etc. So all the inflammatory features of GIT tract Sparsha saha. It's very severe tenderness. The person will not allow palpation. Vranavascha, Vidahu Vranavascha, underline the word Vranavascha. There may be ulcers, gastric ulcer, duodenal ulcers, etc. So Vranavascha Gulmam is Paitika Gulma. Next, we'll move to the Kafaja Gulma. So Kafaja Gulma is Vataja Gulma plus Kapha Prakopa Ahara Viharas, etc. Vataja Gulma, there is already hardening is there, spasm is there, etc. In that condition, if the person go for Shita, Guru, Snigdha, Achestanam, etc., because of intake of these conditions, it will turn up into Kafaja Gulma. So Kafaja Gulma is characterized by Sthaimitham, as if covered with cold, wet cloth, Shita Jwara, Gatra Sada, there is a heaviness in the body, Rullasa, Kasa, there may be cough, Aruchi, Gauravani, Shaityam, Ruggalpam, the what type of pain we have seen in Vatajagulma, the pain reduces, but it becomes hardening, stiff. The tumor or the lesion becomes more hard. So Katina Unnatatvam Gulmasya Rupani Kafatmakas. So Kafaja Gulma we can characterize or we can understand it like any benign tumors, any palpable harder swellings compared to Vataja Gulma. So Kafaja Gulma will be more harder, more palpable, and more saturated. Vataja Gulma, you can see a fluctuation in the pain, fluctuation in the swellings, etc. But in Kafaja Gulma, it will be more harder. So clearly in cut in nature of benign tumors, obstructing the intestine, giving pressure symptoms, heaviness, excessive secretion. So all these come under Kafaja Gulma. So Vata Jagulma is mere spasm, contractions, hardening, expansions. So those are all Vata Jagulma. Whereas Pitta Jagulma is Vata Jagulma plus inflammatory reactions, ulcers, tumors, or perforations, etc. come under Pitta Jagulma. Whereas Kapha Jagulma is Vata Jagulma plus becoming more harder, more rough, more uh, strength strength of the lesion increases, hardness of the lesion increases, so more benign nature. So that is a Kafaja Gulma with more pressure symptoms. Finally, we'll go into the Nichaya Gulma. Nichaya Gulma is a combination of all the three doshas. So Nichaya Gulma, shloka number 17, you can see Maharujam, very severe pain. Maharujam, very severe pain. Daha Paritam, Daha Paritam, excessive burning sensation. Daha Paritam. Ashmavad Ganonnatam, literally like a hard stony swelling. Ashmavad Gana Unnatam, stony hard swelling. Shigra Vidahi, severe suppuration, sudden suppuration. Shigra Vidahi, Darunam, very chronic. Darunam. Mana Sharira Agni Balapaharani takes away the strength of the manas. It take away the strength of the Sharira body, Agni, Bala Pahari. So that Tridoshaja Gulmam is Asadhya. So if you see the features of Tridoshaja Gulma, you get an idea of metastasis. So up to here, Vataja Gulma, Pittaja Gulma, Kapaja Gulma, it is localized. Usually it will be localized with some systemic features. But when there is a metastasis, spreading of the tumor, spreading to spreading through blood, spreading through local spread, spreading through lymphatic spread, etc., or the tumor becomes very stony hard consistency, or the benign tumor, or the tumor becomes fungating or ulcerating, more pittaja features, so it will transform into perforations, or it may transform into severe metastasis, etc. So these are all the features you can see. Maharujam, very severe pain. Daha Paritam, very severe burning sensation. There may be malignant fevers may be seen. because of the malignant tissue becoming metastasis and circulating in the body, it may result in some malignant fevers. So daha paritam, ashmavad ganonnatam. This is most characteristic feature, stony hard consistency. It is a clear-cut stage of carcinoma, or it is a clear-cut stage of sarcoma with soft tissue will transforming into ashmavad ganonnatam, very stony hard consistency. Shigra Vidahi, early separation, or very ready to become separate or fungate. So that is called a Shigra Vidahi. Tarunam, very chronic, and taking the strength of the body, mind, Bala, Agni, everything. So that is the Tridosha Jagulma. So Vata Jagulma, simple compression, simple spasms, etc. Pitta Jagulma, inflammatory conditions. Kapha Jagulma, benign tumors. Nichaya Gulma or Sanipataja Gulma, it is nothing but a tumor with metastasis. Last Gulma is Raktaja Gulma. Raktaja Gulma has a specificity because it is related to Yoni Dosher Gulma. It is related to reproductive area of females, Triyam Rattabhavu Upaiti. So it is related to menstruation, it is related to Garbhashya, it is related to ovary, it is related to vagina. So it is entirely related to menstrual cycle related disorder, and it will not come under the general gulma. Okay, so it is nothing but spandate pindita eva na ange chirat sashulam samagarbhalingam. Raktaja Gulma present like as if there is a fetus in the Garbhashaya. That is the presentation, but there are some differences. That is spandate pindita eva. So entire tumor or the fibroid or the lesion will pulsate. Whereas if there is a fetus, parts of the body of the fetus will there will be a movement. Whereas if there is any pulsation or movement in Raktajagulma, entire lesion there will be a spandate. Spandate pindita eva. Na angir chirat. Whereas in Garbhashya, in Garbha, anga, parts of the body there will be a movement. There will be sashulam pain similar to like that of Garbha and Samagarbhalingam. So this is called as Raudira Gulma. Stri Bhava Eva. It is related only to female reproductive system. Mase Vitite Dashame Chikitsya. So only after the 10th month we should go for the treatment. So that is about the Raktaja Gulma. So next is sloka number 20. We will move into the treatment of Gulma. Kriyavat Kramam Mataha Siddham Gulmina Gulmanashanam. So in Nidanasthanu only na Anila Shanti Rupayaha Gulmina means uh, any treatment targeting Vata is the main line of treatment for Gulma. So the same thing is here again followed. Vataja Gulma associated with Tivra Vedana, etc. Baddha Vindmutra Marutam, etc. If there is a obstruction, if there is a obstipation associated with Gulma, you first treat with Snehe Raditaho Samupachare. If there is a severe pain, there is a severe obstruction, constipation, etc., go with this snehana. So, which type of snehana? Bhojana, Abhyangana, Pana, Niroha, Anuvasana, all different types of sneha, Parivachana can be carried out. After snehana, go for Svedana, Kartavya, Gulma Shanti. When the srotas become Mardava, softens, the nature of Vayu is Ruksha, hard, etc. So that will become softened. The overall Maruta Ulbanam will be subsided. Overall features of Vata Prakopa will be subsided by Snehana Svedana. Bitva Vibandhan Snigdasya Svedo Gulmonam Upohati. So the Snehana and Svedana combination of these two, it will clear the Vibandha, it will clear the obstruction, and it will make softens the intestine, softens the Gulma. lesions. After that, go for Snehapanam Hitam Gulme Visheshenam Urdhva Nabhi. When the gulma is present above Nabi, go for Snehapana. If the gulma is present in below Nabi or Pakvashayagate, Basti Rubayam Jatrashri. Pakvashayagate Basti. But if it is present exactly at the level of Jatara or Nabi, go for both Snehapana as well as Basti. So whenever there is a Deeptagno, Vatike Gulme, Vibande, Anila Varchasam, Brahmanya Annapanani should be started. Brahmana Annapanani, Snigdha Ushnani Prayoje. So Snigdha Ushna treatment, it may be in the form of Snehapana, it may be in the form of Virechana, it may be in the form of Anuvasana, Niroha. So all different types of Snehana, Swedana, Anulomana treatment should be carried out. So hence this shloka is important. Punaha Punaha Snehapanam, Punaha Punaha Niroha Sanuvasana. Means if you have done Snehapana one time, it is not enough. So your target is to make the lesion, softening the lesion and clear the obstruction. Until that, you should give Snehapana, you should give Niroha, you should give Anuvasana, you should give all the treatment like Sneha Shodhana, Sneha Anuvasana, Sneha Niroha. All those things should be carried out until the objective is achieved. That is softening of the lesion and clearing the vibanda. So these two things and subsiding the pain. These three objectives should be based on these three objectives. Punaha Punaha treatment should be carried out. So Punaha Punaha Snehapanam Niruha Anuvasana. That is the main line of treatment for Vataja Gulma. Prayoja Vata Gulmeshu Kapha Pitta Anurakshana. Because you are giving Puna Puna Snehapana, Puna Puna Anuvasana, Virechana, etc., you should also simultaneously protect Kapha Pitta. So kapha and pitta should not go out of control. So you should give puna puna treatment considering kapha and pitta. So that is the line of treatment for vata jagulma. So during this line of treatment, if there is a kapha vitiation, you go for kaphahara treatment. If there is a pitta vitiation, you go for pittahara treatment. If there is a shonita vitiation, you go for shonita prasadana treatment. So Vatahara treatment along with Kapha, Pitta, Shonita treatment should also be carried out. Ado ante madhye cha marutam parirakshata. So this is the important thing. During the starting of the treatment, during the treatment or after the treatment, in due course of treatment, always protect Maruta, Marutam parirakshata. So this may come as a entrance point. Ado ante cha madhye cha marutam parirakshata is in the context of Vatavyadi, Gulma, Grahani, etc. So you should select Gulma. So Ado Anticha Madhyecha Marutam Parirakshatam. These sentences are important. So make a note of this.
Hello, sir. Hello.
Hello. Uh,
Sir, in this question, Adavantecha Madhyecha Maruta Pariyakshana, how to arrange the questions in entrance time?
So they may give as a direct shloka. Ado Anticha Madhyecha Marutam Parirakshata. It is in the
Okay.
context of. So these are all some special things like Punaha Punaha Snehapanam, Punaha Punaha Niroha Anuvasana. It is in the context of. So like this question may arise also. Usually it was a style of Jamnagar line of treatment, Jamnagar line of questioning. Uh, Previously there was separate examinations for Jamnagar, BHU, Jaipur, etc. So usually In Jamnagar and Jaipur, they used to ask this type of questions. Adovantecha madhecha marutam parirakshata. It is in the context of. But now in terms of UPSC, they may ask this type of question. But in UPSC and AAPGET, there are more practical type of questions. Uh, what is the dose of medicine, dose of the drug in this yoga? So, though that type of practical questions are more in AAPGT and UPSC, but one or two questions they may select this type of shlokas. They will select some different shlokas which have some speciality like this, and they may ask. Okay,
Thank you, sir.
to create a difference between a highly learned student to the normal student. So they will select some of at least 5 to 10 questions. They will select this type of shloka oriented questions out of 120. So while you are studying Samhitas, you make a note of this type of shlokas. So next is Pittaja Gulma Snigdoshnena Udite Gulme Paitike Stramsanam Hitam. So in Pittaja Gulma, if it is highly because of Snigdha and Ushna nature, you go for Stramsana. Stramsana is Mrudu Virechana, can be carried out. If there is a Ruksha Ushnena tu Sambhute, if there is a involvement of Ruksha and Ushna type of pathology, you should go for Sarpi. So both can be done. Stramsana and Sarpipana can be done. Pittam va Pittagulmam Natva Pakwashe Stitam. So if Pittaja Gulma, if it is related to Pakwashaya, then go for Satikta Kshirabasti. Kshirabasti line of treatment should be carried out. So if the Gulma is present at the level of Jatara, at the level of Nabi, if it is more Snigdha Ushna nature, go for Stramsana. If the Gulma is present at the level of Nabi, at the level of Jatara or stomach, etc., if it is related to Ruksha Ushna, you should go for Sarpi. If Pittam Gulma, if it is related to Pakwashya, if it is specifically related to Pakwashya, then you should go for Satikta Kshirabasti. So Tilvaka Sarpi Virechana, Tilvaka Sarpi Anulomana or Virechana, this is one of the important line of treatment in Pittaja Gulma. Tilvaka Sarpi Virechana. Shloka number 37. If there is any Rakta involvement in any of these conditions, Pitta Jagulma, Vata Jagulma, Kapha Jagulma, if there is a Rakta involvement, you can go for Rakta Mokshana. Raktam hi Vyamlatam Yati Tacha Nasti Chasti Ruk. So whenever pain is there, Sama condition is there, Rakta associated condition is there in the Gulma, if you go for Rakta Mokshana, the amlata or acidic nature of the Rakta reduces and pain reduces. So this is the shloka number 37, frequently asked. Raktam hi amlatam yati tacham nasti cha nasti ruk. So if you reduce the amlata by rakta mokshana, acidic nature of rakta will reduce and pain reduces. Shloka number 40. So there are two types of gulma based on pakwa stage, apakwa stage. Apakwa gulma, benign type of gulma, guruhu katina samstana. Benign nature, guruhu katina samstana. Hard in nature, heavy in nature, Guda Mamsa Antarashraya, deeply located or capsulated. Guda Mamsa Antarashraya means capsulated. avivarna. There is no excessive discoloration or red discoloration, etc. Redness, avivarna, sthirascha. Avivarna means there is no inflammation, severe inflammation, sthiraschaiva. So this is called as apakva gulma or benign nature of tumor, you can notice. Whereas daha, shula, arti, sankshoba, swapna nasha, arati, jwara. So these are all the features of vidahyamanam janiyad gulma. Metastatic tumor, inflammatory nature. So these come under Vidahi nature or Vidahya nature. First one is Apakwa Gulma, where you can go for directly surgery. Whereas in this nature, you should go for Pittas Shamana, Rakta Prasadana, Rakta Mokshana. So this line of treatment should be carried out in case of Vidahi nature. Look number 42, 43. If any gulma, it is very much related to external skin. If it is very much near so if the tumor or any lesion, it is if it is very much related to skin or bahya samsparsha, shavesa rakta paryante, if there is any inflammatory nature, very much related to skin, then you can refer to Dhanvantriyana Madhikara. Means they can go for incision, drainage, or excision type of treatment can be carried out. So hence it should be referred to Dhanvantriyana Madhikara, means referred to surgery. So Kruta Yogyana. Kruta Yogyana means either you can go for incision, excision, or drainage, etc. Veda, Shodhana, Ropanahi. You can go for Siravedana, you can go for Shodhana, Ropana. So these type of treatment should be carried out. So if it is very much related to skin or bahya, so in Kafaja Gulma, benign nature Kafaja Gulma, Kale Sakshara Katukam Grutam. So Kshara Yukta Katu Rasapradana Gruta should be carried out in case of Kafaja Gulma. So further Gutika, Churna, Niryuha, all these can be carried out in Kafaja Gulma. Whereas Kafaja Gulma, if it has a pedicle, Kruta Moolam, if it has a root pedicle, Mahavastu, if it has a very uh, large lesion, large space occupying lesion, Mahavastu, Katinam, hard, Stimitam, covered with wet cloth like Stimitam, capsulated, etc. Gurum. So it can be treated by Kshara Karma or Arishta Prayoga, that is Tikshna Arishtas can be given or Agni Karma can be given. So Kshara Karma, Arishta Prayoga, Agni Karma. So these are all the different line of treatment for Kafaja Gulma characterized by uh, hard tumor, capsulated tumor, very much related to skin. So these things can be treated by Kshara, Arishta, Agni Karma. Shloka number 56. So Acharya has mentioned the action of Kshara, Chitva, Chitva, Ashayat, Sharaha, Ksharatvat, Sharatyada. The Kshara will desiccate the protein. Kshara will desiccate the muscle, desiccate or burn the proteins, burn the tissues. Chitva, Chitva. So that is the action of Kshara has been mentioned. Even though in Sushruta Samhita there is a detailed chapter about Shara, Acharya has not mentioned the action of Shara, whereas here you can see the action of Shara. How Shara acts. So Chitva Chitva Ashayat Sharaha Ksharatvat Sharayatyada. It will go penetrating, it will go deeper. Next, there is a list of grutas which can be utilized in different types of gulmas. First one is Trayushanadi Grutam. It is useful in Vataja Gulmanut. So all Adhikara. Trayushanadhikruta is indicated in dash disease or Trayushanadhikruta Adhikara. If there is a word Adhikara means you should identify the chapter. In which chapter it is mentioned. That is called as Adhikara. So it is mentioned in Gulma Adhikara, Gulma Chikitsa Adhikara. Whereas indication of Trayushanadhikruta is Vata Gulma. Indication means where it is indicated in which disease. Whereas Adhikara means in which chapter it is mentioned. So Trayushanadhikruta, its adhikara can be asked or indications can be asked. So one more Trayushanadi Gruta is mentioned. Shatpala Gruta has been mentioned. Shatpala Gruta in Raja Yakshma, which will be mentioned in Raja Yakshma, that also can be utilized in Vataja Gulma. Next one is Hingu Sovarchaladya Grutam. It is Shula Anaharam Agni Gulmina, especially in Agni Gulma or Anila Gulmina. Vataja Gulma associated with Shula and Anaha, you can give Hingu Sovarchaladya Grutam. Next one is Hapushadya Grutam. So it is indicated in Yoni Arsha, Grahani Dosha, Shwasa, Kasa, Ruchi, Jwaran, Basti, Hrut, Parsha Shulam. So that is called as Hapushadya Grutam. So specially useful for Vatajagul. Next is Pippalyadya Grutam. This is also for Vatajagulma associated with Yoni Shulam, Shira Shulam, Arshams, Vishama Jwara. The next one is Hingu Vachadi Churna or Gutika. This is one of the important yoga available in market as Hingu Vachadi Gutika, Hingu Vachadi Gulika. So it consists of all these things Hingu, Trikatu, Pata, Hapusha, etc. in detail. It can be given in all types of Shula, Parshu Shula, Hrud Shula, Basti Shula, Vata Kafatmaka Shula, anything which is associated with Vata Kafatmaka. Prag Bhaktam means just before food it should be taken Prag Bhaktam or in the first morsel it can be given Prag Bhaktam or it can be taken with Madhya or Ushnodakena. This is the Anupana of Hingu Vachadya Churna. All types of conditions associated with Vata Kafaja condition in GIT, painful condition in the GIT. Only thing there should not be any severe Pittaja condition, severe ulcer formation, severe inflammation, severe perforations, etc. Other than the severe Pittaja condition, you can give in all the GIT conditions of uh, associated with Vata Kafaja conditions. So, Anaha, Mutra Kruchra, pain in Guda Yonije, Shule Guda Yonije, Grahani, Arsha Vikareshu, Plihni, Pandu Amaya, Richi, etc. So that is Hingu Vachadi Churna or Gutika. Next we can see Lashuna Kshiram. Lashuna processed with Kshira. So this is also good treatment for Vata Gulma, Udavarta, Gridrasi, Vishamajvara. Underline Gridrasi. Lashuna Kshira in Gridrasi. Specific indication. Gridrasi has been mentioned. Vishamajvara has been mentioned. Taila Panchaka. Combination of all the five. That is Taila, Prasanna, Gomutra, Aranala, Yava. So this combination of five is called as Taila Panchakam. Next is Shilajitu Prayoga. Next one is Nilinyadya Churnam. Nilinyadya Churnam or Nilinyadya Grutam. Next, Rohinyadya Grutam has been mentioned. So this is specially indicated for Paitika Gulma. Rohinyadya Grutam, Nilinyadya Grutam. These are all specifically indicated for Pittaja Gulma. Next is Trayamanayadya Grutam. This is also for Paitikam, Pittaja Gulma. Even it is indicated in Visarpa also. In Visarpa, Grutas are less indicated, but this Trayamana Grutam can be indicated in Visarpa also. Amalakadya Grutam, Drakshadya Grutam, Vasa Grutam. So all these are for Pitta Gulma. So next is Dashamuli Grutam. This is for Kafaja Gulmam. Ballata Kadya Grutam. Underline this one. Ballata Kadya Grutam. Very important Gruta for Kafaja Gulmam. So note there should not be any sort of Pittaja condition, inflammatory condition, because GAT, if there is a lesion in GAT, naturally it will be associated with Pitta, but there should not be any ulcer formation, there should not be any perforation specifically, and there should not be any active inflammatory condition. It should be only pure benign or malignant tumor, not associated with inflammatory condition, not associated with perforation or ulceration. Then you can give Ballata Kadya. Next one is Shira Shatphala Grutam. This is also for Kafaja Gulma. Shira Shatphala Grutam. Mishraka Sneha for Kafaja Gulma. So next comes the Danti Haritaki. So Danti Haritaki, if you see Pancha Vimshati Cha Abhayaha, means only 25 Haritaki is involved in preparation of Danti Haritaki. So in this condition, Tato Leha Palam Leadva Jagdva Cha Ekam Haritaki means Leha Pala. One Pala Leha should be taken, followed by one haritaki which is used for preparation of danti haritaki. Among 25 haritakis, one haritaki should be chewed after intake of one leha pala leadva. One pala of danti haritaki leha should be taken, followed by one haritaki should be taken in the form of chewing. So by intake of this, there will be sukam virichite snigdho dosha prastam manamay. Means after intake of this, there will be virechana. This is specifically a virechana yoga. All dosha will be cleared. So dosha prastam, one dosha or one prastha dosha will be evacuated. So this is indicated in all types of gulma, shvetu, arshamsi, pandurogam, arochakam, rudrogam, grahani dosham, kamala, vishamajvara, etc. So after intake of this, person should take mamsarasa or vodana, only rice or mamsarasa. That should be the ahara or pratyahara during the intake of Danti Haritaki. Will not go into the much details of other forms of gulma, treatment of Rakta gulma, all those things, because not so important for entrance point of view. So that's why I'm skipping all those things. So that is about gulma chikitsita. So gulma is not an imaginary disease; it is a more practical disease. As we can see the description of gulma in detail from Nidanasthana as well as Chikitsa Sthana. To understand the gulma, understand the important line of treatment of gulma, important yogas of treatment of gulma. So in those conditions, in that time lineage, there was no endoscopy, there was no laparoscopy. So only the tumors which are amenable, easily accessible from the external part of the body, that has been subjected to surgery, that has been subjected to Shara karma, that has been subjected to Agni karma. So rest of the things, practically it is treated by Snehana, Punaha Punaha Snehana. Basic idea is to soften the lesion and to clear the vibanda. So that is the more sophisticated line of treatment in case of gulma.